So I'm Rob Rawson. I'm the trainee supervisor and a pathologist at RPA Hospital, and obviously I'm here to talk about AP training at RPA. It's a pretty good place to come, and I think it's good for junior trainees. Often, like a lot of you guys, there's 3, I think, junior trainees at RPA in the room, and hopefully they would agree with me. It's not a bad place for a junior trainee to be, and also not a bad place to finish off your training or go halfway through your training. So Tim, who spoke earlier, he's the polished product of almost 5 years at RPA, and I'm sure exams will be favourable. So we're looking forward to Tim getting his fellowship and moving on. So why is RPA a good place to be? I think it's got really great people, and also get really fascinating work there. So I'm not going to take up too much of your time. It's a pretty information-heavy afternoon, I know. So we've got about 15 full-time equivalent pathologist positions, about 9 registrar positions at RPA. It's a very busy place. We've got more than 30,000 histology specimen, heaps of cyto, and a lot of molecular work that comes through. It's a really diverse mix of cases you get, and we look at pretty much everything you look at in pathology, probably except for paediatrics and cardiovascular, the main things we don't have at RPA, but overwhelmingly everything else you need to know to become a pathologist you can learn at RPA. Whilst it's busy, you get a really great training and teaching program. Leading up to exams, I think we have pretty much a tutorial every day, and after exam we quieten down a little bit to give everyone a break, but we ramp it up again later in the year, so lots and lots of teaching, both formal and informal, and practice exams, etc. I think unique to RPA, we have some internal rotations in areas of molecular pathology and also dermatopathology, things like particularly melanocytic pathology. We also have close links with the neuropathology, which is a different department on the same campus, and once you get your fellowship, like hopefully Tim will, there's also fellowships, particularly at RPA, which you can do another year of, especially training in head and neck pathology and also dermatopathology. So that's basically what training looks like at RPA. What else do? We really have great research opportunities at RPA. We've got some of the best world leaders in their field, which can help you start your research career or continue your research career if it's something you've already done. And we really encourage everyone to get involved if they'd like to. I think the people at where I work are really fantastic, and I'd really like to think that registrar group is some of the best bunch of registrars I've ever worked with. That's been the same for the last 5 or 6 years since I've been a trainee supervisor. A real collegiate group that work together really quite well. We're based sort of around Sydney Uni and Newtown, so a great place to go to the gym or have a drink after work. And there is an on-site gym at the hospital, which is pretty cheap as well. And also there's a trainee supervisor who I've heard is pretty good. So I'll leave it there, and happy to take questions or get in touch with me after this or any other time.
Richard from Coffs Harbour couldn't be here today, so he's entrusted me to present his slides. Probably that's all we need to show, isn't it, actually? Pretty good slide. All right, so yes, this will be the first time Coffs is offering registrar positions next year, and there'll be 2 positions. Oh, I also didn't mention the regional registrar positions have fully funded accommodation, so that's a bit of a bonus. So 5 pathologists, Richard and 4 others working at Coffs Harbour. A brand new AP lab, looking pretty good. Lots of dissection tables, and they have all the latest and greatest machines, lots of immunos and antibodies and so on that need to be used for your training. Services the Mid-North Coast, lots of cases. I think you can probably all read those. So it's a bit of a niche area, Coffs. It's an excellent place to live. It's got an excellent bunch of pathologists. I reckon it's a pretty nice place to start your training or to rotate there if you're looking for somewhere for second year rotations. So as I mentioned, 2 registrar training positions, probably at least one of those will be rotational as of next year. We're pretty keen to encourage pathologists to move to the North Coast. Lismore's another opportunity for consultant pathologists who completed their training, so that's why we're encouraging registrar positions in these areas to facilitate some growth in that consultant area. So lots of experienced supervisors, some excellent consultants up in Coffs who are very looking forward to seeing you up there next year. Great place to live. Great place to live. I think I'll just leave it there.
Sorry that I couldn't be there in person today, so First of all, good on you all for choosing to come and investigate a career in pathology. In 2013, as a first-year registrar just like you, I changed from a surgical career and I've absolutely no regrets. Sorry, if I could just go back a slide. And I'm speaking to you on behalf of our department, which is co-located at RPA and the University of Sydney. So advanced slide, please. Thanks. So we offer 6 or 12-month rotations, and when you work with us, you're given a great deal of responsibility and will be expected to provisionally report surgical cases, which is why we prefer people who are post-Part 1 exam. So in addition to ample reporting time, you'll learn more about molecular techniques which are crucial to brain tumour diagnosis, and other components of the rotation include forensic pathology and muscle biopsy pathology as well. And harking back to Rob's talk, you're able to attend the tutorials at RPA, which happen at least once a day, if not more. Advanced slide, please. Thanks a lot. It's a great rotation. You get to function like a consultant and always with ample supervision. You'll have plenty of reporting time, and you have to present at multidisciplinary meetings, which only enhance your skills for when you finish as a pathologist. You'll learn how molecular techniques contribute to an integrated diagnosis of brain tumours, and also how molecular pathology works in general. And we also have a very busy consultation practice. We receive consults from around the country, New Zealand and the Asia Pacific. So when you're with us, you'll have a concentrated exposure to very interesting and rare brain tumours, as well as a whole host of other neuropathology as well. Our neuropathology registrars are also very fortunate to be able to interact with the staff at tissue pathology, and as I mentioned, the tutorials, but also getting to know the consultants there as well. Finally, having additional training in neuropathology when you finish up looks great on your CV, because it's an area of pathology which some people find intimidating, and it enhances your future job prospects. Advanced slide, please. Thanks. So we are looking for someone with a willingness to learn new skills. So as I said, the bulk of your work will be brain tumour pathology, but you'll be expected to be involved in muscle biopsies and forensic neuropathology. Someone with good organisational skills. This is crucial for us because you are at the forefront of coordinating molecular testing and following up with the integrated diagnosis. Someone with great communication skills. So you have to manage 3 neuropathologists, all of whom are doing 3 and more different subspecialties within neuropathology. You also have to liaise with autopsy staff, the molecular staff, as well as the muscle laboratory staff. So organisational skills and communication skills are crucial to the job. And also take initiative. You are our only registrar in the department, so you should be able to take initiative and able to triage surgical cases and order IHC stains, but know when to ask for help as well and know your limitations. Advanced slide, please. Thanks. So come train with us in 2024. We'd be very happy to have you. If you're interested in more information, you can email myself. I'm not the registrar supervisor this year. It's usually Joanne Sy, who's on long service leave this year. But if not myself, then you can contact the head of department, Associate Professor Michael Buckland. Thanks a lot.
Hi, this is Ken. I'm the registrar supervisor as well as director of Gosford. Now, advanced slide, please. And one more, please. So Gosford is in Central Coast between Sydney and Newcastle. Advanced slide, please. It's about 60 minutes by car from Sydney. And next one, please. And if you take public transport, it's about 1.5 hours by train. Advanced slide, please. Now, we're part of the New South Wales Health Pathology family, and we service Gosford Hospital and Wyong Public Hospital. We have about 11,000 cases per year, histo, and about 2,000 cyto cases per year. Advanced slide, please. And in the department, we have 2 full-time registrars, 5 staff specialists and fully staffed, normally 4 full-time and 1 part-time. 10 laboratory scientists and also 2 secretaries in the department that will give you help. Advanced slide, please. And we've got a very spacious registrar room, which it's a rarity in Sydney. I think And of course, if you move up here, then you get access to all the beaches and all the nice spots in Central Coast. And and this is our club area, very modernized, touchscreen monitor and very good ventilation. Advanced slide, please. And as you can see, some days work isn't too bad. And thank you for your attention. If you have any more questions, you can ring me or email me. I'm sure they'll distribute our contact numbers at the end. Thank you.
Thanks so much, Kenneth. And as well as living in Gosford, if you work at that hospital, you get the opportunity to work with Kenneth, which is definitely a bonus. He's very supportive and great teacher. So thank you, Kenneth.
Hi, I am Rinki and I'm representing Wollongong Hospital and Southern IML. So if you remember the map shown by Kenneth, it's at the south coast of Sydney. So it will be a joint position, and you will have the opportunity to work both in public and the private setting, and it will be a unique opportunity to work with a comprehensive range of case mix from both public and private labs. We've got 5 registrars and 1 resident over 2 locations, and 65,000 histology cases per year across 2 locations. We've got 25 MDTs presentations per month, and we've got connections with the medical school, so there will be lots of teaching and research opportunities. The selling points are Wollongong is a great place to live, and we've got lots of beautiful beaches. We've got 5 registrars and 1 RMO position, so it's not big and it's not too small. Currently we have 2 positions for 6 months rotations to DHM and St. George. Cut-up is not onerous, and we have 3 teaching sessions rostered per week. It can be more sometimes, and you will get subscription to Elsevier and WHO Blue Books, and everything is covered except specialities like transplant biopsies, renal biopsies and electron microscopy. You will be involved in reporting, frozen sections, lectures, QAP and MDTs, and it will be a great opportunity to work in both public and private settings, and which will have a different case mix and will prepare you for life in the real world. There is email at the bottom of the slide, and if you have any questions or if you want to visit the lab, you can email me at any time. Thank you so much.
Hi, I'm Dan. I'm from Prince of Wales. I'm a third-year registrar, but I'm also the current senior registrar. So it's going to be a very brief presentation. So we have 14 pathologists. We got 5 trainees at the moment, and we got residents throughout the year. One of which was Sim, and he actually worked with us for 6 months. We have, so basically we have a wide range of specimens that come to us, because we are linked with Prince of Wales Public and Private, the Royal Hospital for Women, Sydney Children's Hospital, and also the Sydney Eye Hospital. So we get a wide range of specimens with adult and pediatric as well, which is a nice thing about it. So this is like an overview of what we get. Just the things I mentioned. The other thing we get a lot of soft tissues, which is one of my favorite area of pathology. We get renal in both native and transplant. We get neuropathology. We get cytology, dermatopathology, and then obviously for hospital for women, we get a lot of gynecology specimen. A lot of placentas. You learn to love them when you get that. For Sydney children, we get obviously the pediatric specimen, and there's also perinatal pathology and postmortem that you can be involved in if you wish. And then for Sydney Eye, you get ocular pathology. They used to do on-site frozen section for Sydney Eye, but not anymore post-COVID. And then you get dedicated teaching for those areas. So the bosses always have an open door policy. Most of the time the door will be open, like they always willing to, come and talk about anything. There's, like I say, a broad range of cases to report. You do get a lot of reporting time. You get about maybe 1 or 2 a week. This is what a usual roster look like on the top right. You get about 2 reporting day and then 2 cut-up days, so 1 big and 1 small. And then a fresh frozen section day. There's active involvement in a variety of MDTs, and even though you are allocated to 1 MDT per term, but you are always welcome to join any of the other MDTs. There's chance to double report and sign out at the senior level. There's a formal teaching and practice exam, like I mentioned, and then there's also opportunity to do student teaching to the University of New South Wales, and also a probable conjoint appointment as well. This is just on the bottom right. It's just something I started when I started working. So every term I do a Registrar and RMO award. It's basically just like a fun way to celebrate the term. So things, and also it's just like a very informal voting. So things like who is the most likely to get reselect, who is most likely to have shit days, and who is most likely to get certain specimens. So it's just something that I do for fun. And most of the time the resident is the one to get the most likely to get placentas, as Wasim would know. And this is just the last slide, so it's just a very brief overview of our lab. Transport-wise, it's very convenient. So the L2 line takes you directly and stop right in front of the hospital. So even if you fall asleep, it's okay. Like it will just get you there and you won't miss your stop. And this is our cut-up room. So we've got big cut and small cut-up room in view. There's also a separate transfer room and a separate autopsy room. There is a potential, maybe we might be moving to a new building. Nothing is confirmed yet, so I haven't really put it up there. We often get food for special occasion, and this is where our main lab, where the magic happens. And there's a pub nearby, so the registrar like to go to celebrate or just rant about work. But yeah, if you have any questions, you can contact. So Dr. Yvonne is actually our training supervisor, but she's away in Germany having a good time. So in the meantime, you can contact our head of department, Trent Davidson, or you can contact me. Just remember that there's someone else with my name as well. So I'm not the OG, but I'm number 1.
Hi everyone, I'm C1 and
I'm Chin Chin.
We're the first year AP registrars currently working at Orange Hospital, and we're there for 6 months this year and then moving on. So we're introducing Orange, which has about 800 to 10,000 AP cases per year, about 100 to 300 blocks cut per day, and there's a wide range of specimens including GI, urology, skin, gynae, as well as lung biopsies on occasion. There isn't any neuropath or medical renal biopsies, and we do get a few frozen sections, once or twice a month, which is very exciting. There's an opportunity to attend EBUS and FNA with the consultants, and there's always regular MDTs once a week for all of the different specialties, and you're welcome to join in or help with the preparation of them. And with the staff, it's the 2 registrars and 4.2 FTE AP bosses, along with the technical staff and scientists. Orange also happens to have one of the best libraries in the state, very comprehensive with all of the latest textbooks and WHO Blue Books as well.
So some of the highlights that, do you want to?
Oh yeah, do you want me to?
So some of the highlights that we experience in Orange is that every day in the afternoon, the pathologists that get together around the multi-header and discuss really difficult cases and are not too sure about umming and ahhing. And we're always welcome to join in on these sessions, multi-head with them, discuss the cases, ask, what is the cell? And they'll tell us. There's also one pathologist that's assigned to teaching that week. Sometimes they may get a bit busy, but if you knock on their door, they'll always come around and bring you slides to discuss and teach you things, which is really good. There's plenty of teaching slides. They're scattered all over our reg room, so you'll find a teaching slide somewhere in the room. And Harry, one of our most senior pathologists, he will always get us involved with the QAPs. He'll always like sit down, he'll be like, oh, do you want to go through the general QAP this week? And we'll be like, yeah, let's do it. And he will sit down for a whole afternoon with us and go through each slide and discuss those cases with us, which is super good for teaching. And one of the other things is that our room we share with the consultant haematologists in the hospital, and they are always happy to be asked questions. One of the consultant haematologists even sat down and taught us how to read trifines and always give us interesting cases, and will discuss that with us, so it's really good. Yeah.
So in terms of some admin details, there's great accommodation and it's fully funded through the STP funding. You also get extra financial assistance to attend conferences and courses. So I was able to attend Path Update this year, fully funded. And you also get access to online teaching sessions, and we also get the Registrar Slide Exchange, which is very nice to go through. Each registrar will then rotate on in the next 6 months to another hospital. So I'll be heading off to Royal North Shore Hospital, and Chin Chin will be heading to Westmead. Other than that, Orange is such a lovely location. It's only a 3.5 hour drive from Sydney, 5 hours by train, haven't been by bus. And there's direct flights from Orange to Sydney as well as to Brisbane and Melbourne. I was able to attend the Melbourne conference through a direct flight as well, which is very handy. And that's it. Thank you.
Hello everyone, my name is Shelley. So I'm a registrar from St George. So we are servicing the southeastern Sydney catchment. We also get a lot of specimens from Southern Hospital, as well as we service the St George Private, Hertzfield Private and Carina Private as well. So we get specimens from public and private sectors. These are the contact details if you want to email anyone. Our training supervisors Kim and head of departments Con, and that's my email if you do want to reach out. That's just a view of our cut-up room. So we do actually get a view of the airport, and you actually do get to see Brighton Lee Sands from the cut-up room. So we're on level 4. In terms of training at St George, we have 4 registrars, and one of the registrars will be the first year job share with Wollongong. So you spend 6 months, either the first or the second half at St George and the other half in Wollongong. We process about 300 to 500 blocks per day, and that's including small cut, big cut and transfers as well. We do have technicians doing all the transfers pretty much every day, and they're short staff. In terms of the way we structure our roster, so you're either on small cut, big cut, or you're on the 2 reporting days. So small cut, you also covers fresh tissue triaging. On your big cut days, you just deal with big cut, and on frozen section is inbuilt with one of your reporting days. In terms of tutorials, we get cytology tutorials as well as sort of pathologist tutorials as well. So usually 2 tutorials per week. We do have interesting cases sessions and journal clubs that registrars can get involved with, and we also run all the QAPs. The registrars run all the QAP sessions, so we usually sit at the front of the room and all the pathologists sit at the back of the room, and we usually try to answer all what we think the QAP questions are like, and usually will get grilled by the pathologist at the back of the room. So yeah, good. It's quite nerve-wracking, but good learning opportunities. Yep, I've covered a few of these. So on average, 2 days of reporting, some days better, 3 days. And usually usually when you're on reporting days, you follow a pathologist. So that's usually the frozen or on-call pathologist. So you always have someone to go and grab cases. All the pathologists are really friendly, so they pretty much all of them have a sort of double header that you always welcome to double hold with them. We cover all the systems, some more than others. So we do have medical, renal and liver, and some limited neuropathology as well. We don't have that much soft tissue, derm or pediatrics. At St George, the registrar are responsible for some NDT, so we do the head and neck, colorectal and the southern urology. The bosses do some take care of the rest of the MDTs, and you're welcome to come join them or do it with them as well. We do have some opportunities to perform or attend FNAs, and we do take part in the UNSW medical student teaching, so about 2 or 3 sessions per 3 months or so. So that's good if you do enjoy teaching as well. So yeah.
I ended up at Nepean by a very happy, I guess you could call it, accident. So I was supposed to be at Westmead, spend 6 months at Westmead, then 6 months at Concord, and what happened was that 6 days before my rotation at Westmead was due to begin, I got an email saying that they were rotating me to Nepean, which is part of their sort of general strategy with registrars. People normally do a 3 to 6 month rotation out of Westmead, and that's where one of the Nepean registrars comes from. The other is there for the full 12 months. And so I'm basically more talking to the first years to be, or the prospective trainees, because at the moment for the past couple of years the pattern has been that both of the registrars, similar to in Orange, are first years. But honestly, it's the happiest thing that's happened, like despite the late notice. Like honestly, I couldn't be more thrilled with where I've ended up. I think that the good thing about Nepean is that it's central but not too central. So if you are just starting out in pathology, if you're a first year completely overwhelmed with all of the information you're receiving and all of the learning that you need to do, it's a really great place to get a wide variety of cases and work in a supportive environment without being completely swamped by work and swamped by too much sort of pressure from the hospital system and from patients. It's a reasonably big hospital still, even though it's on the outskirts of Sydney. We also serve all of the private labs around the area and from the Blue Mountains as well, so we get a really good range of specimens, a lot of urology cases, which a lot of other hospitals don't really get. We get a lot of neuropathology as well, obviously not as much as RPA, but it's a really sort of good variety to start out with. We have a good number of pathologists. We have a dedicated head and neck specialist called Faraz, and he works at Westmead as well. And if you're at either side, he's really amazing to learn from, particularly as a first year. I think the really good thing as well is not just how supportive the pathologists are, but the relationship between the pathologists and the lab and technical staff. So there is no, I guess, there's no tension at all between any of us. We have a fantastic relationship with the scientists. We have a 2 dissection scientist, one who's just started, but one who's been there for a really long time, who's incredibly experienced, amazing and supportive. So even though we don't have that sort of senior registrar support, we get that support from both the pathologists and from the tech staff as well. The lab manager's super friendly and super approachable as well. So it's a really collegiate environment and a great place to sort of start out if you want to be eased into a very comfortable transition to pathology and to be encouraged to continue. I think this is a really good place to start. We have a cut-up schedule that is cut every day but for half a day. So unlike sort of some other hospitals, I don't really know which is better, I haven't experienced both yet, but some other hospitals sort of do 1 day cut and then 1 day reporting. We do a bit of cut and a bit of reporting every day, which sort of takes the load off in terms of brain strain, and you get a little bit of variety. If there's one particular thing, like you're not so fond of cut, you still get to report every day. If you really like cut, you get to cut every day. So I think it's kind of the best of both worlds. I would also really recommend, like, if you're planning on going to Westmead to get that really sort of big tertiary hospital subspecialised exposure, considering doing a 3-month rotation to Nepean and really putting your hand up for it. Because I got the rotation by accident and was sort of pleasantly surprised by what happened. But if I were to go again, I would definitely stick my hand up instead and get that tertiary experience, but also then sort of go out to a different site, see more uropathology, and just get that smaller hospital experience as well. So, yeah.
Michael Krivenak from the Children's Hospital. I'm the trainee supervisor. Nikki's the head of department, but she's over in Switzerland at the moment doing a renal pathology course. I can actually see some parallels with that Nepean story there. I did a rotation to the paediatrics in my final year as a trainee. I didn't put my hand up for it. Somebody suggested, you know, would you like to do a paediatric? You need to do a rotation anyway. I never left. I did that term. I did my final 6 months as a trainee there. I did a year as a fellow, and I've been a pathologist there for 10 years now. So yeah, please consider it. And I guess what I want you most of all to get out of hearing me today is that a paediatric subspecialty rotation is not something that you should only do if you're interested in having a career in paediatrics or perinatal pathology. It's a really good term for pretty much any trainee. You know, unless you're going to work at DHM and all you're ever going to see, for instance, is skin, or you really know exactly what you want to do. If you're going to be in any sort of pathology department that does any sort of general work, this will be a good term for you. You'll see a lot of very good stuff. So where does it fit in? So we're one of the 2 subspecialty training program rotations. Most people come to us for a 6-month term. I've also got Joanne Toe, one of our senior registrars, here today, so if anybody wants to ask something of a registrar rather than the consultants, see Joe afterwards. Most people come for 6 months. Joe's come back to us again. Basically, it can be a path to a paediatric or a perinatal career, but you don't want it to be only that. It really complements what you'll see in your adult work and in your general pathology departments. We do have significant overlap with what other departments see. We see all the various systems. The only difference really is age. Now, if you go into a general pathology service, you will see lots of paediatric things. You'll benefit from coming and seeing those with us. It does expand on what you already know, so we don't recommend that people come and do the subspecialty rotations in their first year. Not so much because we can't cope with it, but because you won't get as much out of it as if you do it later. So basically we do prefer post-Part 1 candidates. We do try to give you as much responsibility as we can. There's a lot of triage. There's a lot of fresh tissues, there's a lot of frozen sections, there's a lot of interesting cases that are going to be familiar, but you won't have come across them necessarily exactly that before. So we do prefer the post-Part 1 candidates, but you know, somebody who's pre-Part 1, preferably not first year, will also have had quite a few of those, and they've still had really good terms. There's 4 of us, one of us is full-time, 2 registrars. You'll notice on the cut-up numbers, it's only 3,500 a year, so that's, you know, compared to the numbers you've been seeing, fairly low. Part of that is because there's also a perinatal autopsy component to the service that we provide. But the other half of it is that, you know, we don't get large numbers of cases, but what we get are interesting. We get appendixes, we get pilomatrixomas, they wash through quickly, but the other half of the cases, they're challenging, they're interesting. We do see pretty much the full spectrum of organ systems. Really what we don't do is much in the way of gynae, breast pathology, prostates. You won't see many carcinomas if you come to us. We've got really good exposure to the molecular cytogenetics side of things. We work really closely with our lab, both on our surgical tumour cases, but also for the perinatal autopsies as well. We've got really close links with research in tumour bank. You know, something like 60 or 70% of the kids that come through with a neoplasm are on some sort of trial. So you get really good exposure to that. We don't have a formal rotation to the cytogenetics departments, but you know, we can certainly facilitate you going down and spending a little bit of time there as well. We get a lot of interesting cases referred to us, you know, from externally as a part of a consultation service. And again, you'll have opportunities for things like presentations, case reports, participation in MDTs, grand rounds, that sort of thing. You won't get a lot of cytology with us. A bit more on terms of the actual specific pathology that you'll get, lots of general stuff. Transplant pathology is another big one, pretty much everything. We do a lot of liver and kidney transplant work, but we also get cardiac and lung, even intestinal transplant biopsies I had just last week. The full spectrum of paediatric tumours, you'll see those, of course. You'll get placental pathology. You won't be cutting huge numbers of placentas. We probably get less than many other sites, but they're almost always associated with an autopsy or a fetal death in utero, so they tend to have a lot of pathology. We do our own immunofluorescence, you'll see Hirschsprungs, you'll see epilepsy, so really good, interesting cases. So not large numbers, but you can go into a lot of depth on them. So really, what I want you to take out of this is it's a useful term for anybody. If you can get your hands on this, please come and see us. If you've got any questions, more than happy to flesh out more details about the term, but it's not for anybody only who's interested in paediatric or perinatal pathology. Just briefly on the autopsy side of things, we know that you haven't done it. It's rare for somebody to come now who's actually got autopsy experience. We're used to that. Basically, we take it bit by bit. First you'll see them, then you'll do it with us watching. Then you'll do the simple, straightforward ones, but we'll guide you through that. And by halfway through the term, you'll be quite comfortable doing a routine paediatric or perinatal autopsy. So yeah, we're 5 minutes away from here. I walked across central Sydney. It's a great place to work. Please consider us.
Hello everyone, my name is Sri Lakshmi and I am representing Australian Clinical Labs. I'm the trainee supervisor at ACL. ACL is a private lab located in Bella Vista, which is the heart of Western Sydney. It's Australian Clinical Labs is one of the largest private clinical labs, and it's in a unique position because of the mix of cases that we get in. The input is not just from being a private lab, of course, the majority of the input is from the GPs. However, we do get a lot of hospital cases from two big private hospitals, that's Norwest Private and Northern Beaches. So you get to see a variety of case mix right from the beginning of your training or whichever year of training that you are in. Our histology cases are about 75,000 per annum, do a lot of cytology, especially the non-gynae cytology. If you're planning to give the cytology exam, this is one area because we get a variety of cytology. We're 10 consultants. We're not a very big group, but we're all passionate about teaching, and we're a very friendly group, very approachable, and we love our registrars, and we try our best to help them every moment. So there are 4 registrars, 3 from ACL and 1 rotation with Concord registrar. And so we have a lot to offer in the sense that if you're early in the training, yes, you're learning the basics, but if you're a few years down the training, this is the place to be because it gives you a great insight into how the private world works. I was a registrar here, did my part 1, but oh boy, don't I look back, and I'm really thankful for the experience as a registrar because that prepared me as to what the private world is. You know, in terms of your turnaround, your performance indicators, all that you tend to gain while you're early in your training rather than having to grapple once you're on the other side of the finish line. So as I said, referrers are from both GPs, Northern Beaches Hospital and Norwest Private Hospital. So we have cut-up is, yes, we are very flexible. Depends, we leave it to our registrars. What do they prefer? Do they want to do cut-up and leave 1 day reporting, or do they want to do half and half cut-up and reporting? But we give the choice to them. We're very flexible with that, and we have technical scientific officers who do all the mundane stuff of the skins and guts and POCs. Unless they're oriented complex skins, we usually ask our registrars to concentrate more on the big specimens. Again, to reiterate, we don't get neuro or renal biopsies, but apart from that, because Norwest and Northern Beaches private hospitals are big tertiary hospitals, we get a good case mix.
Hello. My name's Jinichi. I'm actually one of the junior staff specialists representing Royal North Shore Hospital, based in the leafy suburbs in St Leonard's. This hospital is a tertiary referral centre and has and is well serviced by public transport, including rail at St Leonard's Station, if you're so inclined, and also if you wish to travel by car, we actually still have parking. Hello. Okay, so what's the breakdown? So. We have a lot of major subspecialties, which including GI, gynae, breast, sort of cardiothoracics. Endocrine is a big centre for endocrine. We've got hemopath, head and neck, plastics. There's some neuropathology, urology, derm, and we are servicing a very busy sort of renal transplant unit. I'm actually one of the renal pathologists, so you get exposure to that. Although it's not an examinable component, if you get exposure, it will serve you well when you finish. It's a good skill to have. We get a small number of soft tissue. Oops, what's happened? Yep. Yep, so I'll just keep going. So we get a small number of soft tissue and a wide range of secondary consults. The case numbers, we're fairly busy with the surgical pathology cases. Those are the numbers. And a decent amount of non-gynaecytal renal biopsies, as mentioned before. And we also do have muscle biopsies. The breakdown is we spread the work across 17 pathologists, which is equivalent to 12 full-time equivalents. There are 6 registrars in total. The junior registrar rotates out to Orange, as you've heard from one of our little rotators, I see one, and Lachlan, who is in the audience, I think is going next. So, are we going? Which one? This one?
No, it's just...
Oh, okay.
Try that again. Okay, there you go.
All right. So, what would you end up be doing? So, the typical registrar duties, so cut up, so big cut and small cut are separate. And when you're combined with small cut is frozen and fresh duty. So in total you get sort of roughly between 2 to 3 sort of duty days, if I would say, and the rest of the time is actually protected reporting time. All the cases go to the reg room first, and you can take your pick. I think some of the unique things with North Shore is we have this what's called out by 8, where all the urgent blocks get reviewed by a reporting reg, and then they'll get instructions from the supervising pathologist on how to handle the case. They may even offer you opportunity to report that specimen if it's appropriate to your level. In general, I think teaching is fairly frequent. We have weekly teaching sessions of different subspecialty consultants. Also, we have some sort of interesting cases every Tuesday and Thursday afternoon, where the bosses show each other around and registrars are free to join and look at them. Some of them can be quite problematic even for a junior consultant like myself, so it's good handle on how you handle difficult cases. And more importantly, sign out. So currently we have 2 sort of Part 2 candidates almost finishing, and they are allocated cases of their own to sign out. So this happened on a sort of rotational basis, 1 week on, 1 week off. And you also get handle on medical renals as part of that. So really, in terms of not just passing exams, but preparing you for consultant life, I think it's actually important you get exposure to that. So that's why we've instigated this new system. So, okay, so the other thing I wanted to highlight is I know people say, oh yes, there's teaching and research opportunities, and Royal North Shore is affiliated with University of Sydney and the Collins Institute, and there are actually plenty of teaching opportunities, but also research opportunities with results. These are some of the former registrars who've churned out papers during their time at Royal North Shore. So if you're academically minded, please consider Royal North Shore, and happy to answer questions both at the meet and greet or later if Lisa can divvy out my number. So thank you very much.
All right, I'm Bruce. I'm Bruce Chow. I'm one of the anatomical pathology registrars at Liverpool Hospital. And today with me, I've got my colleague Teja, one of our post-part 1 registrars as well, so we're both post-part 1, and we also were going to have Matty with us, but unfortunately she hasn't been able to make it as well. So she's one of our staff specialists who have a interest in medical education as well. So here you've got a photo of part of our department. We are a big department that services a fair amount of area in southwestern Sydney, and this is a happy photo of us post-COVID times. So in essence, Liverpool get it. I'm sorry. I'm actually not sorry. Is a laboratory that is a tertiary level laboratory that is under the auspices of New South Wales Health Pathology. We do a fair histopathological load at around 32,000 cases per annum, with 4,000 cytology cases, potentially with a non-gynecological cytology predominance, with a head of cytology who is extremely experienced in training a lot of senior cytologists and also consultants around Sydney, if not internationally as well. Our hospital services a 900-bed facility and also acts as a drainage point for Campbelltown Hospital at 1,000 beds, Bankstown Hospital at 450 beds, and also we do a fair amount of private work with Southwest Radiology and Spectrum Radiology as well. So you will see a veritable amount of particularly non-gynecological cytology, and in fact we roster people on to do the cytological collections, rows, and also assist with FNAs post-training with our head of cytology, with view towards preparing candidates for the Part 2 examinations and also practice beyond. Our load in terms of the number of pathologists that we have on site, full-time and part-time aggregates of pathologists, amount to 16 consultant pathologists with 7 registrars and a head of department who has veritable international experience as the journal editor for pathology for around at least an 8-year period. Now, Liverpool Hospital is a place whereby we aim towards holistic training. From the beginning registrar who is starting out in pathology all the way to the end of training as the budding consultants and preparing them for real life practice as well. So from the point of view of the way that registrars are trained, there is a grassroots approach to cut-up and microscopy. Complex cases, which can range all the way up to pelvic exonterations, so tumour debulking, the procedures secondary to complex tumour involvement of surrounding organs, including bladder. They are supervised by a assigned pathologist on the day, and all our complicated specimens are supervised with instructions about cut-up at the bench, and certainly opportunities to subsequently report to develop good block selection practices. We also have renal and skin DIF preparations as well, with an active electron microscopy facility through our scientist Murray for the electron microscopy arm. We also have a molecular laboratory as well that is operated under by our head of department. There is a lot of opportunity to follow up cases of variable complexities from bench to microscope, and the consultants are extremely approachable. Our standardized, so we have standardized hours in terms of cut-up, and we do have approved over time if the workload gets higher. So our workload does somewhat fluctuate. There is a active non-gynecological cytology program. So exam candidates will be under a 6-week training program with our head of cytology, who is a scientist. There's also an approach that is designed that as you are taught on the cut-up bench, they will prepare you for the Part 1 written exams. They will also prepare you for the Part 2 viva examinations as well. Here you can see the offices and the resources that are on offer. We do have a veritable slide collection, which also includes collections that are shown in national lectures. There is also a collection that is a complete collection of California Tumour Registry slides. There is an active culture of consultant teaching at Liverpool Hospital. Our consultants are world recognised in terms of teaching capability, and they aim towards exam readiness. We run the Western Sydney University exam preparation course that runs across a week, available to trainees preparing for examinations. They pump out around 140 cases at multi-system level, rotating for histopathological cases over a 2-year period, and certainly there is also a small biopsy and cytology arm to this course as well in a second week. We also do a lot of mock examination activities. The recent move for the college to move towards electronic examination methodologies has been caught on by our consultants, training trainees for exams, and we do have electronic slide scanning capabilities, and we do have 3 to 4 tutorials a week, which is online and multi-header setup. The head of department runs a Tuesday weekly tutorial for an hour, where trainees are committed to type in answers for him to real-time review for cases that are shown as though you are in a CETRA examination setting. Additional specialty tutorials including dermatopathology and renal. We cut DIFs for skin biopsies and renal biopsies, and you will receive training to do this as well. There's also a one-on-one examination preparation tutorials on request that the pathologist today who couldn't be here also runs for our trainees after hours. At the end of the day, exam preparation is one thing. However, the importance cannot be emphasised that we train trainees to become safe and effective consultant pathologists. So we span the whole range and spectrum of training. There is regular live reporting opportunities, 3 to 4 reporting days in a 7-day rolling cycles. There are multiple MDT meeting opportunities which cover all organ systems. We also have WSU, so Western Sydney University and New South Wales, teaching opportunities with opportunities for conjoined positions as well. And there is also multiple research opportunities. So in this slide, what I've shown you is my desk from a day-to-day workbench with ergonomic heads for microscopes. And also on the left slide is some of the case, was a case that Tristan Rutland, who does national lectures, actually put on Twitter around several weeks ago, which shows the features of a fibromyxoid sarcoma. And this was actually a case that was cut in our laboratory. So you can see a fibromyxoid background with curvy linear vessels with MUC4 positivity, which is classic for this entity. And certainly the biological behaviour tends to be quite indolent, but can get very aggressive if not picked up and mistaken for some non-malignant tumour process. As a map, Liverpool Hospital is out west. It is not in the centre of Sydney, but of course you've got areas such as Bankstown, Fairfield and Cabramatta nearby. In terms of facility, Cabramatta is full of yummy Chinese food. And there's also Aljana, which serves more fried chicken than KFC per serving. And also you've got childcare facilities and also other intra-hospital gym facilities available at the hospital. So in short, could this be for you? We have a collegiate culture, we have excellent examination preparation and seasoned teachers and researchers. But of course, our cut-up load is quite high. We do need you to have a good work ethic, which has been ameliorated by 1 FTE cut-up scientist that takes on quite a bit of load in the small case room as well. We have a lower number of pediatric cases in frequent gynecological cytology and extended commute, but I use my commute to read all my textbooks. So I got all my study done, a lot of it done on the train itself. We have a brand new laboratory moving in the next 2-3 years. It is a growth corridor with a lot of possibilities for future consultancy work. For any further questions, these are our contact details. Feel free to call us, feel free to visit us, feel free to email us. We really hope to see you working with us in Liverpool Hospital. Thank you very much.
I'm Alexander. I'm one of the registrars at St Vincents or SIDPath, and here are contact details of our head of department, Dr. Angela Field, and our registrar supervisor, Andrew Parker. You can email me or even just call up the registrar room if you want to visit. Any of us are happy to be contacted. So St Vincents supplies, or services rather, both private and public work. So we've got a public hospital that is attached to our pathology, but we also get a lot of GP work as well as from a variety of different private hospitals in the area. We've got a rather large department, 15 pathologists and 7.5 registrars. One of them is a 3-monthly rotation, 3 months at St Vincents and then 3 months at RPA or elsewhere. We have a very big variety of specimens that come through. We don't have things like gynae, pediatrics, and we don't get too much soft tissue, but we do have quite a specialised heart and lung transplant service. So if you are interested in those sorts of things, it's probably one of the only places you can get explant lungs and hearts to see what pathology we have. And we also get eye pathology as well. I think Prince of Wales was the only other place mentioned, but we get a lot of ocular melanoma as well as lymphoma. So if you're interested in those things as well, come to us. You'll get experience of those. We do have autopsies, none this year, 6 last year. It's very variable, so you might be able to assist in some of those. We have registrar on call. It's not onerous, so only once in every 6 weeks or so. It's mostly over the phone, fresh tissue triage. You don't often need to come into the hospital, and even if you do, it's only about half an hour to an hour at a time coming in to just do a bit of service work, splitting that tissue or whatever's need to be done. We have FISH and next generation sequencing that's actually done by our anatomical pathologists in the department, and so that happens most days of the week. So if you want to, you can talk to those pathologists who report those, and you can definitely get experience of that. They also quite often want to do extra research and like the registrars to be involved in that. So plenty of research opportunities there. We're expected to attend and present at MDTs, as most places are, and then there's medical student teaching, which is available to be to you as well. Why choose us? We're a friendly department. Everyone is very happy to get involved, help each other out. All our pathologists as well, very happy to come if you've got any questions, want to double head. If you've got cases that you want to take from them and report for yourself, they're very happy for all that to happen. We have regular teaching, so most weekdays around lunchtime we have around the multi-header, we go through a variety of cases. Post exams, once you've done your small biopsy exam, they're happy for you to start doing some independent reporting as well. If you're preparing for exams, you can take a microscope home, take some study sets. They're very happy for you to do that and study from home. They as well will support you if you want to go to a conference or do any courses for one within the state and one interstate per year. Anything else? We've got lots of food around us. We every Friday have Thai food, which we order in. So one of the reporting registrars will go and make the order for us and pick it up, and then we all get around. Some of the pathologists also join in for that. We love cake. These are a variety. I think 2 of these are from this week and some from elsewhere. And this is just a photo of us at Potts Point, which is about 10 minutes away. Lots of lovely restaurants there. We're 10 minutes from King's Cross Station, and if you want to take a bus from Museum Station in the city, I think buses leave every 5 minutes and don't take very long to go right to our doorstep. So it's quite a central location, good training experience there. We have a big range of opportunities, so it's a good place to come. Thank you.
Hi everybody, I'm Melanie and I'm one of the registrar supervisors at Douglas Hanley Moir Pathology, and this is a picture of our building where we live in Macquarie Park near North Ryde. So these are our registrar supervisors. There are 4 of us because we're quite a big place. We've got about 60 pathologists. I should have got an update on the number because it's growing all the time. And we have usually 10 or 11 registrars. So we're actually the biggest pathology practice in the Southern Hemisphere. But I do want to say, you know, we're big, but we're friendly. We're not some factory churning through just skins, Michael. I do want to say we actually see a very broad range of specimens, and our pathologists represent the breadth of expertise in pathology and include, you know, a number of experts, you know, world-renowned experts in their fields in soft tissue pathology, lymphoma pathology, genitourinary pathology, and so on. And all of us are very friendly and smiley, just like in the photos there. We do get involved in teaching. We do have research opportunities. I know everyone says that, but those articles that Jeannie put up, a number of the authors on those papers are actually working at DHM, as you'd know. So, you know, we are also involved in research as well. And, you know, it is a great team. You know, I want to have a shout out to our registrars, the 10 or 11 of them. It seems like a lot of people, but they're really cohesive and they are just great guys. They put on a morning tea for us pathologists yesterday to say thank you for, you know, all our help in getting them ready for exams. We had a lot of people sitting exams this year, and you know, they are a really great team, and I think it's you know, something really good to be a part of. So as I said, not just skin, broad specimen range, and also there is no real small cut-up. So we're really at the cutting edge of getting scientific staff to help with cut-up. So in order to, you know, decrease the service component of your work, you know, we are committed to the college's guidelines of keeping registrar cut-up to under 20 hours per week, and I think we're pretty close to that usually. Other good things, we do have teaching sessions. Even if every pathologist only did 1 session per year, you'd have, you know, at least 1 teaching session per week, and a lot of people do a lot more than that. And, you know, we really are committed to teaching. We see our registrars as our future colleagues, and, you know, there's a lot of job opportunities for registrars finishing to come and work with us. We do attend a lot of clinical meetings. We have connections to many public and private hospitals where we're involved in the MDTs. Personally, I attend a urology meeting that's based at St Vincents and one at St George as well, so where we work with the public hospitals to you know, show the pathology, and our registrars get involved in those as well. Obviously we're not attached to a hospital as such, but we do provide services to a number of private hospitals, and our registrars come with the pathologists to both Macquarie Uni Hospital and the SAN to get exposure to frozen sections and fine needle biopsies. And you know, we are involved in a lot of rotations as well. I always encourage our registrars to get out and see the public hospitals as well, and for anyone in public to come and spend 6 months with us too. We do have 1 position that is 6 months at RPA and 6 months at DHM, so there's obviously 2 people in either half of that position. And we don't see a lot of medical renal or paediatrics, so, you know, I can highly recommend. I did a term in paediatrics as a registrar, so go and see Michael. I think it is a great thing to do. But yeah, no, DHM is a bit of a different experience, but we certainly, you know, work collaboratively. We're a great team, and, you know, we all have connections to the public hospitals as well, and we're proud to be a part of, you know, multidisciplinary teams and so on. You know, I would encourage you to talk to our registrars. That's Roger Kim's email. He's our senior registrar, and the phone number there gets to the main registrar rooms. They're sort of in 3 different offices, but most of them are at this phone number. And you can call or email us, and I encourage you to come and visit us and see what the facilities are like and what we can offer you. I am actually away for the next couple of weeks, but if you drop me an email or get in contact with Roger, I'd be more than happy for you to come out and see what we're doing here. Anyway, I'll stop talking so that you can all have some snacks.
Just to sum up now, thank you very much to all the presenters. I'd especially like to thank the registrars who have taken the opportunity to present today. I know how nervous it can be to present to a room this size of people, so I'd like to thank you for your contribution to today and being able to share your experiences with others. And I'd like to thank Kathy for coming from the college, and also particularly to thank Maria and Lisa and Sam for making today work. This might be a modern building, but it is not very intelligent, and we have had a few technical difficulties, so while they look serene, that's above water, and they've been paddling furiously all day to make sure this all works. So I'd like to particularly thank them for organising today. I think it's fair to say that NSW doesn't stand for just Newcastle, Sydney and Wollongong. But we have an opportunity to go from as far north as Coffs through Tamworth and Orange down to Wagga, as well as all of our labs in the greater Sydney, Newcastle and Wollongong areas. In both the public and private sector, one application for all of those sites. Don't forget, it opens on the 18th of July and closes on the 8th of August. 50 to 100,000 people apply, so please don't leave it for the last 2 days. Like 60% of people do, because the system is not that good at having 20,000 applications in one day. So do put your applications in early. You do need to apply. We can't consider you if you haven't put your application in. But I'd just like to thank you for your time today. All of these presentations will be available. The important bit is about to happen. And that is, you've got all of those people who've done a presentation, and there's got to be a lab somewhere in there that interests you. Okay, we've got the widest range of laboratories, both geographically and in service delivery, from the very, very young to the very, very old, and everything in between. So now is the opportunity for you to go and talk to those people for those locations. Can I reinforce what Kathy said at the beginning of this afternoon? If you are really interested, please show that interest today with the people who are here to listen to you. Please make the effort to go and visit them. I'm sure that you've heard how welcoming they are, and they would be really keen to welcome you to have a look at their lab. I'm an equal opportunity educator, so I can't say whose lab I have a favourite of. What I can say is there is no better opportunity for training than in New South Wales. And all of those labs have their own things, and I won't go over them all again. So please take this time to mingle, to talk amongst yourselves, to talk to the labs that have piqued your interest today, and an opportunity for you to go and visit those labs, make yourself known to those staff, get to have a feel, look and feel. For those of you who are in your JMO positions, you can see the RMO roles that we've got, but also very good if you're interested to let those labs know and go and visit them wherever you're working at the moment. I'm sure they'd be very happy to show you around. So on behalf of New South Wales Health Pathology and all of our private and other laboratories that are training anatomical pathologists, and on behalf of Kathy, I'm sure, for the college, thank you very much for your time today. Please mingle, enjoy the company, make yourself known to the labs you're interested in, and look after yourselves. And Kathy, of course, is here to answer any questions about the college, which she'd be very happy to do. So that's it, full stop. We'll let you go.